Thedieck.
And I'm Mary Jo Muse.
And our presentation is to validate the Campbell's thesis statement on diabetes mellitus in the China Study book, which is Chapter 7. The Campbell's thesis statement states that with a high-carbohydrate, low-fat diet, a plant-based diet may help prevent diabetes. To prove this argument made in the China Study book, Mary and I looked at 4 different articles that were referenced. The first article we included was titled, Increased Incidence of Non-Insulin Dependent Diabetes Mellitus Among Japanese Children Correlates with an Increased Intake of Animal Protein and Fat. The research purpose of this study was to evaluate if the intake of animal protein and fat correlated with the increased incidence of non-insulin dependent diabetes among Japanese school children. These school children range from primary to junior high school students. Researchers believe that the increased consumption of animal fats and proteins combined with low activity of school children may have intensified their overall glucose intolerance and their insulin resistance. The school children, ranging from ages 6 to 15, were tested annually for glycosuria by glucose oxidase tapes to detect diabetes. If the first test was positive, glycosuria was confirmed in these children by an oral glucose tolerance test. The study showed that the increase in animal fat and protein in the Japanese diet was more closely related to the yearly increase of non-insulin dependent diabetes mellitus incidence in school children, rather than due to an increase in energy intake or the prevalence of obesity. This study was included in the China Study because it supported the author's idea that increased consumption of animal fats and proteins increases an individual's chance of developing diabetes. The second article was titled Diabetic Diets, High Carbohydrate Combined with High Fiber. This study was from 1980. In this article, researchers evaluated diabetics with both high and low carbohydrate intakes to see whether the effectiveness of fiber supplementation was influenced by the level of carbohydrates in their diet. By doing this, it evaluated if the use of fiber-rich diets would allow diabetics to eat proportionally more carbohydrates without loss of diabetic insulin control. The 19 diabetic subjects ranged from ages 21 to 70. They were placed on a 10-day metabolic diet during their study. The fiber supplement guar was added to certain foods within this diet. The diets provided a certain amount ranging from 14 to 26 grams, added to foods such as porridge, fruit juice, bread, soup, mashed potatoes, custard, chocolate mousse, or crisp bread. The results of this study show that when taking fiber supplementation, in this case guar, with high carbohydrate intakes, there is a high reduction of urinary glucose. However, when subjects were placed on a low carbohydrate diet with an intake of guar, no reduction was seen. This study was mentioned in the China Study and supports Campbell's thesis because it supported the idea that dietary fiber supplements with a high carbohydrate diet can be beneficial to prevention of diabetes mellitus.
The third article that we looked at was titled Associations Between Diet and Cancer, Ischemic Heart Disease, and All-Cause Mortality in Non-Hispanic White California Seventh-day Adventist. This was a cross-sectional cohort study, and the purpose was to summarize associations in the use of different foods to chronic diseases. The researchers sampled people of that religion that were over the age of 25. They conducted the study by mailing out a food frequency questionnaire and a lifestyle questionnaire to determine if the dietary factors have an influence on chronic diseases between vegetarians, semi-vegetarians, and non-vegetarians. The researchers determined that the dietary factors do have an impact on the chronic diseases and that vegetarians had the lowest risk factor due to their strict plant-based diet. This study in turn supported the Campbell's thesis that a plant-based diet may help to prevent diabetes. The last article we studied was titled Hypolipidemic Effects of High Carbohydrate, High Fiber Diets. This study was a non-randomized clinical trial and it consisted of 2 purposes. The first one was to examine the changes in serum cholesterol and triglyceride levels. The second purpose was the effects of the control diets in the high-carb, high-fiber diets on the cholesterol and triglyceride levels. The control diets consisted of 43% carbs, 18% protein, and 11 grams of plant fiber, while the high-carb, high-fiber diet consisted of 70% carbs, 18% protein, and 34 grams of plant fiber. The researchers sampled men who had diabetes that had multiple fasting blood glucose concentrations of 200 milligrams per deciliter. They also had to be in the age range of 50 to 54 and had diabetes for at least 6 to 8 years. They studied two groups depending on the different body weights of the men, and the men were given control and high-carb, high-fiber diets. They weighed each patient daily as well as drew blood before breakfast each day. The results showed that the control diet and the high-carb, high-fiber diet had no significant alterations in body weight and that they provided equivalent amounts of energy. However, their results showed that the men that were on the high-carb, high-fiber diets were allowed to reduce their insulin dosage. Overall, the researchers suggested that the high-carb and high-fiber diet could be beneficial to people with diabetes because it helps lower the serum cholesterol levels. This article supported the thesis because it showed that a high-carb, high-fiber, plant-based diet can help manage diabetes, but it is undetermined from this article if it can be fully prevented from this diet. Further research still needs to be carried out. In conclusion, with evaluating these articles, we determined that the thesis was supported by all four articles mentioned in the China Study Project with their provided evidence.